Welcome to The Explainer. Today we're tackling a massive but often overlooked medical problem affecting literally a billion people. How a standard dose of medicine can be a total gamble when a patient's weight is a factor. Yup, 1 billion. That's the staggering number of people the World Health Organization projects will be affected by obesity by 2025. Now, this isn't just some abstract statistic. It represents a fundamental and urgent challenge for medicine. Why? Because for this huge population, getting the right dose of a drug is anything but simple. You see, for these patients, getting the dose right is incredibly complex. So today, we're going to explore why that one-size-fits-all approach, especially with antibiotics, so often fails, and how medicine is adapting to solve this life-or-death puzzle. All right, so let's jump right in. To really get a handle on this, we first need to understand the sheer scale of the problem. It's about a lot more than just a number on a scale. The source material is really clear on this. Obesity is linked to a much higher risk of getting serious infections. We're talking about everything from complications after surgery to a weakened immune response, even to vaccines. This makes getting the right dose of an antibiotic absolutely critical. This isn't just a minor tweak we're talking about. It can literally be the difference between a patient recovering and a real disaster. So, what's actually happening inside the body that makes dosing so tricky? Let's take a look under the hood, so to speak. It all starts with this really dramatic shift in what the body is made of. But here's the part that might surprise you. It's not just about more fat tissue. Obese individuals actually have 20 to 40% more lean body mass too. We're talking more muscle, bigger organs. This completely changes the entire internal map that a drug has to navigate. To really get what's going on with these changes, we have to talk about a concept called pharmacokinetics. Now, don't let the big words scare you. All it really means is the journey a drug takes through your body. Think of it like a package being delivered. How it gets in, where it goes, how it's processed, and how it eventually leaves. And a really critical part of that journey is something called the volume of distribution. Now, the easiest way to think about this is like the size of the pool that a drug has to fill up in order to work. If you have a bigger body with more fat, more muscle, more blood, that pool gets way bigger. And what's wild is that obesity messes with every single stop on that drug's journey. Absorption can be slower. That pool we just talked about, it gets bigger. The liver, which is like the body's processing plant, changes how it works. And the kidneys can actually start clearing the drug out of the system faster. It just creates this super unpredictable environment for any medicine you put in. So all these changes inside the body, they force doctors to ask a question that sounds simple on the surface, but is incredibly complex. If a patient's body is just physiologically different, what weight do you even use to calculate their dose? And this is not just some academic question. If you get it wrong, you're either looking at the treatment completely failing because the dose is too low, or you're risking dangerous toxicity because it's too high. Okay, so the most obvious choice, right? Just use the number on the scale, the patient's total body weight. But here's the catch. The body's systems don't just scale up in a simple linear way. If you just go by total weight, you often end up giving way too much medication, which can lead to some really nasty side effects, like kidney or even nerve damage. All right, so if total weight is too much, what about the other extreme? There's something called ideal body weight, which is just a formula based on a person's height and sex. But the problem here is that it completely ignores all that extra muscle and increased blood volume we talked about. This can easily lead to serious underdosing, where the drug never even gets strong enough to actually fight off the infection. And this is where it gets kind of crazy. This quote really brings the whole problem into focus. The source material points out something stunning. Ideal body weight, this metric that clinicians have been using for decades, it was never even designed for dosing drugs. It was created by the insurance industry. Mind-blowing, right? This huge dilemma has led to a third option called adjusted body weight. You can pretty much think of it as a compromise, a mathematical formula that tries to find a workable middle ground between the two extremes of total and ideal weight. So what this all boils down to is that clinicians have to throw out the old one-size-fits-all playbook. They have to customize the treatment not just for each patient, but for each specific drug. And this table here gives you a little snapshot of just how complex that decision-making is. So take vancomycin, a drug that loves water. It's hydrophilic. It spreads out into all that extra lean mass, so guidelines often say to use the total body weight. But then you look at another water-loving drug, acyclovir, and the recommendation is to use the adjusted body weight compromise. Then, for a fat-loving or lipophilic drug like linezolid, the standard dose might work, but you have to watch the patient's blood levels like a hawk. The big takeaway here, there is no single, easy rule. This all comes together in a kind of multi-step clinical strategy. First, you've got to pick the right weight metric for that specific drug. Then, you might need to tweak the dose itself, or even how you give it, like through a slower, extended infusion. You absolutely have to consider the drug's properties. And finally, the most precise tool in the toolbox, you actually measure the drug levels in the patient's blood. And that last step has a name: Therapeutic Drug Monitoring, or TDM. This is a huge shift. We're moving away from just guessing based on a formula to actually measuring what's happening in the patient's body in real time. It's becoming absolutely essential for personalizing these doses, making sure the treatment is not just safe, but that it actually works. So, where does all this leave us? What's the big picture for the future of medicine? Well, the core takeaway from all this research is something profound, but also pretty simple. In medicine, one size does not fit all. That whole idea of a standard dose for a standard person, that's quickly becoming a relic of the past. And the source material is very honest about this. It makes it clear that while these strategies are a huge step forward, the science is still playing catch-up. The information out there is often sparse, sometimes it's even contradictory. There's an urgent need for more research to turn these educated guesses into rock-solid, evidence-based guidelines. And that leaves us with a final, really powerful thought to chew on. As the very physiology of our global population continues to change, our medicine can't just keep up. It has to evolve and personalize right there with us.